This is an old topic from the general physiology, okay. That is hormone actions, okay, mechanism of action of hormones. As you are just right now entering into endocrinology, so this topic might be considered under endocrinology, or this topic may also be considered under general physiology. So this is a very vital topic. What I want you to remember at least the classification, and that will really help you a lot. If you study medicine, and further if you study endocrinology, if you study gynecology and obstetrics, whatever branch you choose, so that part is very essential. Every time you will require the mechanism of hormone action, okay. So say for example insulin. So someone is asking you, these are very common questions in theory as well as in your Viva VOC examinations. So someone may ask you the very basic question, what is the mechanism of action of insulin? Okay, so can you tell me, this question is coming from endocrinology or this question is coming from general physiology? Okay, it is from both, right? So in general physiology also you need to study how insulin acts. In endocrinology also, very specifically when you are studying all the hormones separately, insulin, glucagon, thyroid stimulating hormone, T4, TSH, glucocorticoid, right, mineralocorticoid. Okay, so when you are studying all the hormones individually, then you are studying details of mechanism of action of that hormone, say for example insulin. But if you remember a very few pages from your general physiology, even if you do not study or you skip few things under endocrinology, you will be able to answer this very well, okay, if you study general physiology. So these things are covered, how hormones act. So these things are covered under both the general physiology and also in endocrinology, okay. So basically what you need to remember is the classification. How do we divide the hormones depending on their actions, okay. So I guess all of you know from your biochemistry knowledge that we divide hormones into steroid hormones, peptide hormones, in this way according to their chemical nature, okay. So their chemical nature, whether they are steroid, whether they are lipid or they are carbohydrate, right. So depending on their chemical nature, biochemistry people, they will divide hormones depending on chemical nature. But we are very fond of dividing hormones based on their actions, okay, based on their actions, how they act. Depending on their action, we divide hormones, okay. So let us elaborate it. How do we divide hormones depending upon their action, okay. So there are some hormones that bind to cell surface receptor, okay. There are some hormones that can penetrate the cell membrane, okay, moves inside the cytoplasm and they do some downstream activities, okay. So simply take an example. If I take insulin as an hormone, right. So as a hormone, so if I take insulin, this hormone binds to cell surface receptor. It cannot penetrate into the cell, right, because insulin is basically a peptide hormone, right. Insulin is a peptide hormone. I guess all of you have studied the structure of insulin, the chain A, chain B, the connecting peptide, right, okay. So insulin is basically a peptide hormone, protein, right. So a protein, it cannot penetrate the cell membrane. You know the structure of cell membrane, how the structure of cell membrane is there, it is yes, protein lipid, right. So protein lipid bilayer, okay, lipid protein bilayer, and currently the accepted theory is fluid mosaic model. There are phospholipids and proteins are embedded within it. Some are integral protein and some are peripheral protein. This is the structure of cell membrane, okay. Now it is only the steroid hormones that can penetrate inside, okay. Rest of the hormones, any hormone you take, like thyroid stimulating hormone, adrenocorticotrophic hormone, right, insulin, glucagon, any hormone you take, they cannot penetrate inside the cell membrane. They cannot penetrate the cell surface and go inside the cell. But it is only the steroid hormones, and there are some other hormones as well other than steroid, okay, that can penetrate inside the cell, okay. Now how does hormone do their further mechanism of action. Take any action of insulin. Take any action of insulin. Okay. So insulin क्या क्या करता है? So basically its function is grossly its function is to reduce blood glucose level, right? So blood glucose reduce करने के लिए जो जो करना होगा वो इंसुलिन को करना होता है, ठीक है? So how can we reduce blood glucose? So to reduce blood glucose, I can convert glucose to glycogen, okay? Or there is a process called neoglucogenesis inside the liver, okay, where non-carbohydrate substrate is converted to glucose. तो ब्लड में अगर ग्लूकोज कम करना होगा तो हमें क्या करना होगा? नियोग्लूकोजेनेसिस को स्टॉप करना होगा, राइट? और ग्लाइकोजन सिंथेसिस हमें एनहांस करना पड़ेगा, राइट? और ग्लाइकोजेनोलाइसिस व्हिच इज ए प्रोसीजर दैट कन्वर्ट्स ग्लाइकोजन टू ग्लूकोज, इसको भी स्टॉप करना पड़ेगा, ठीक है? एंड इंसुलिन डज ऑल दिस थिंग्स, ठीक है? सो इंसुलिन प्रोमोट्स ग्लाइकोजन सिंथेसिस, इंसुलिन इनहिबिट्स glycogenolysis, insulin inhibits neoglucogenesis, okay? तो ब्लड ग्लूकोज को रिड्यूस करने के लिए जो भी करना है इंसुलिन करता है, राइट? ओके, नाउ टेक एनी एग्जांपल ऑफ एक्शन, से फॉर एग्जांपल ग्लाइकोजन सिंथेसिस. नाउ इंसुलिन इसको प्रोमोट करता है, ग्लूकोज टू ग्लाइकोजन, जिससे ब्लड में ग्लूकोज कम हो जाएगा, राइट? ओके, वेरी बेसिक, ओके. तो हाउ डज इंसुलिन डू दैट, ठीक है? कैसे करता है इंसुलिन ये? हाउ टू प्रोमोट ग्लाइकोजन सिंथेसिस, कैसे करेगा इंसुलिन ये? एनीवन? आई मीन मैकेनिज्म ऑफ एक्शन कैसे करेगा, ठीक है? To promote glycogen synthesis, I need to act on the enzymes, okay, that are involved in glycogen synthesis, ठीक है? So here is glucose, okay. Now there are multiple steps, and it is converted to glycogen, right? Okay, and there are lots of you know all the intermediate substances that are formed. I guess you have studied in biochemistry, right? Okay, I don't also remember, so I can't write. Okay, so there are lots of steps from glucose to glycogen, okay, and in all these steps there are involvement of enzymes, okay. So E1, E2, E3, E4, in this way there are multiple enzymes that are involved in glycogen synthesis. नाउ इंसुलिन कैसे ग्लाइकोजन सिंथेसिस को एनहांस करेगा? इंसुलिन विल डायरेक्टली स्टिमुलेट these enzymes, right? Insulin will directly stimulate those enzymes which are involved in glycogen synthesis, correct? Okay, now insulin क्या है? Insulin is a peptide hormone that is being secreted from the beta cell of the pancreas. Okay, now it is inside blood, okay. Insulin is being secreted from the beta cell of the pancreas, now it is in blood. Now how to do that? Okay, to do this thing is happening where? Glucose to glycogen. ये कहां पर होता है? कहां पर होता है ये? लीवर में होता है, मसल में होता है, ठीक है? तो मसल में होता है, तो इंसुलिन नीड टू बाइंड टू हेपेटोसाइट्स, ओके. इंसुलिन को कहां पर काम करना है? हेपेटोसाइट्स में एंड मसल सेल में, ओके. सो से फॉर एग्जांपल दिस इज अ हेपेटोसाइट, लिवर का एक सेल है ये, राइट? दिस इज अ हेपेटोसाइट, लिवर का एक सेल. नाउ ग्लाइकोजन, ग्लूकोज इज कन्वर्टेड टू ग्लाइकोजन हियर इनसाइड द हेपेटोसाइट्स, ओके. नाउ ये जो प्रोसेस है इसको एनहांस करना है, कौन करेगा? इंसुलिन करेगा, राइट? नाउ इंसुलिन कहां पर है? ब्लड में है, सेल के बाहर है, यहां पर इंसुलिन है, ठीक है? तो हाउ इंसुलिन विल एक्ट ऑन दिस सेल एंड प्रोमोट दिस थिंग, ओके, ये हमें जानना है. This is called the mechanism of action. Okay, इंसुलिन का एक्शन क्या है? Promote glycogen synthesis, inhibit neoglucogenesis. This is called insulin's action. Now what is mechanism of action? Action को कैसे करेगा? This is mechanism of action. Okay, so for this insulin need an access into the cell, but insulin को inside the cell कोई access नहीं है. ठीक है? Insulin has to get access inside the hepatocyte so that it can promote glycogen synthesis. But insulin cannot enter into the cell. There is no access, right? So this is why insulin has to bind on the cell surface receptor, which is specific for insulin. Clear? So we have a cell surface receptor. Okay, it is called IR or insulin receptor. Okay, now this insulin will bind here. Okay, insulin will bind here. Now as soon as insulin binds here, there is a structural changes over here. Okay, structural changes over here, there is an enzymatic activity, right? And that specific enzyme is called tyrosine kinase. Okay, tyrosine kinase activity. I am coming to the classification. So basically the thing is, whenever a hormone has to do some work, it needs access into the cell. Okay, some of the hormones like steroid hormone, they can directly enter into the cell and perform their action, but the other hormones which have not access into the cell, they will bind to cell surface receptor, just like insulin. Its receptor is on the cell surface of hepatocyte, skeletal muscle cell, right? Okay, now after binding insulin to insulin receptor, this receptor insulin complex will be formed and they will begin an enzymatic activity, tyrosine kinase. Okay, enzymatic activity. Now there are lots of proteins involved inside the cell. Okay, many proteins are involved, GRB2, MSOS. So many proteins are involved inside the cell, and finally they will promote transcription. Finally, inside the nucleus, they will promote transcription. Okay, they will activate some transcription factors. Okay, the same transcription factors that are responsible for synthesis of these enzymes. Okay, you know what is transcription, what is translation, what is transcription? Okay, RNA synthesis, translation, protein synthesis. Okay, so ये सब जो एंजाइम्स है फ्रॉम ग्लूकोज टू ग्लाइकोजन, ये सब एंजाइम्स क्या है? प्रोटीन है, राइट? तो इसका सिंथेसिस होता है न्यूक्लियस में. ओके, इसका सिंथेसिस होता है, राइट? ट्रांसलेशन होता है, ट्रांसक्रिप्शन होता है, उसके बाद ये सब एंजाइम्स फॉर्म्ड होता है, राइट? तो इसका जो ट्रांसक्रिप्शन प्रोसेस है उसको एनहांस कर देता है इंसुलिन. ठीक है, सो दैट मोर एंजाइम्स दैट आर इन्वॉल्व्ड इन ग्लूकोज टू ग्लाइकोजन, ओके, दे आर मैन्युफैक्चर्ड. Okay, glycogen synthase, the enzyme glycogen synthase, इसका एक्टिविटी, इसका फॉर्मेशन, इसका मैन्युफैक्चरिंग प्रोसेस को बढ़ा देता है by enhancing the transcription factors. So this is how insulin acts in a nutshell, because in between there are lots of steps. I am not going into the details. We will study when we will discuss specifically action of insulin, what are the inside proteins involved and how insulin does these things. Okay, so this is overall the mechanism of action of insulin. Okay. In this class today, I want you to remember the classification of hormones based on their mechanism of action, so that if I pick any hormone, okay, if I pick any hormone, you say what is the mechanism of action of ACTH, you say what is the mechanism of action of TSH, you say what is the mechanism of action of adrenaline, you say what is the mechanism of action of glucagon, you say what is the mechanism of action of insulin, you say what is the mechanism of action of growth hormone. Okay. So if you remember the classification, any hormone I can ask and you can answer, this hormone acts in this way. Okay. So this is why you need to remember the classification. Okay, right? And believe me, it is so useful in your medical curriculum that it will help you in pathology, it will help you in pharmacology, it will help you in medicine, it will help you in surgery, right? Okay, because if you remember those mechanism of action, depending on mechanism of those actions, we can target with drugs. Okay, if I want to stop insulin action, we will block this receptor, we will block this receptor by a drug. Okay, this is the drug. If I use a drug that binds here, insulin will not be able to bind here, right? So this part is very, very essential if you remember, right? Okay, so grossly till my discussion up to this 2:30, okay, till my discussion, how can we classify receptors? Broadly, there are some hormones that can enter into this cell by penetrating the cell membrane, and there are some hormones which have no access into the cell, so they bind on the cell surface, right? Okay, so basically hormones needs receptors where they will bind. Okay, so there are some hormones. The basic two classification is cell surface receptor and intracellular receptor. Cell surface receptor and intracellular or intracytoplasmic receptor. Okay, so receptor can be of two types. So basically it is a classification of receptor. Okay, classification of receptor. Okay, depending on the receptor, hormones will act. Okay, so some hormones have got the cell surface receptor and some hormones have got intracellular receptor. Okay, जैसे for example, एक तो आपको पता चल गया already, insulin has got receptor which is located on cell surface और cytoplasm के अंदर, cell surface में होता है. Okay, now steroid hormone, इसका receptor कहाँ पर होता है? Cell surface में होता है कि cell के अंदर होता है? Cell के अंदर होता है, right? Okay, तो receptor we classify into cell surface and intracellular. Now directly we will not go in this way because cell surface receptor इसका further sub classification है, ठीक है? But first come to the intracellular receptor. पहले इसमें आ जाओ, intracellular receptor, ठीक है? So intracellular receptor, जो hormones का receptor cell के अंदर होता है, ठीक है? इसका एक mnemonics है, ये mnemonic आप lifelong याद रखो. Okay, the mnemonic is STDR. Okay, STDR. Okay, so there is no fifth. चार ही हार्मोन है, ठीक है? There are only 4 hormones that have got their receptors inside the cell. Okay, either cytoplasm में या फिर न्यूक्लियस के भी अंदर, ठीक है? So there are 4 receptors that are intracellular. तो कौन कौन से hormones है जिसका receptor सेल के अंदर रहता है? S means steroid, T means thyroid hormone, T3, T4. Okay, D means vitamin D. Okay, R means retinoids. Okay, and there is no fifth. ये चार ही हार्मोन है जिसका एक्सेस सेल के अंदर है, ठीक है? तो ये लोग स्टेरॉइड हार्मोन, थायराइड हार्मोन, विटामिन डी एंड रेटिनॉइड्स, they have direct access into the cell. Okay, they can directly interact with the nucleus. Okay, and they can directly change the transcription. कौन से प्रोटीन का ट्रांसक्रिप्शन बढ़ाना है, कौन से प्रोटीन का ट्रांसक्रिप्शन कम करना है, they can directly enter into the cell, interact with the nucleus and change the transcription pace, transcription velocity. ठीक है? ट्रांसक्रिप्शन को बढ़ा भी सकता है, कम भी कर सकता है, ठीक है? जैसे स्टेरॉइड हार्मोन, ये क्या करता है? इन्फ्लामेशन को कम कर देता है. जब भी कोई इन्फ्लामेटरी डिजीज होता है, वी गिव द पेशेंट्स स्टेरॉइड. जैसे rheumatoid arthritis, ठीक है? Rheumatoid arthritis, that is an inflammatory process that destroys bone surface, right? Rheumatoid arthritis, तो यहाँ पर हम लोग स्टेरॉइड से ट्रीटमेंट करते हैं, right? We give the patient steroid. या फिर नेफ्रोटिक सिंड्रोम जिसमें स्टेरॉइड यूज होता है, तो जो भी बहुत सारे इन्फ्लेमेटरी डिजीज है जिसमें हम लोग स्टेरॉइड देते हैं. स्टेरॉइड क्या करता है? And if you have heard during COVID time, if you remember during COVID time, patients were being treated with steroids, right? During COVID-19 crisis, right? We were treating patients with steroid. Why? To reduce inflammation, right? So how does steroid reduce inflammation? There are inflammatory markers like interleukin 1, interleukin 2, interleukin 6, okay, tumor necrosis factor alpha. So these are inflammation causing cytokines, okay, these are inflammation causing cytokines. Now when we give steroid to the patient, steroid has got access into the cell, directly they can enter into the cell, right, and interact with the protein manufacturing machinery. आपका protein manufacturing machinery कहाँ पर होता है? न्यूक्लियस में होता है, right? protein manufacturing machinery आपका न्यूक्लियस में होता है, right? transcription, translation, right? Okay, now steroid can enter into the cell, it can binds its receptor, we call it steroid response element, SRE. Now once steroid binds its receptor inside the cell, steroid receptor complex, they move into the nucleus and they can enhance transcription or they can decrease transcription. They will enhance the transcription of those cytokines which are anti-inflammatory, and they will reduce transcription of those cytokines like interleukin 1, interleukin 2, interleukin 6 and tumor necrosis factor alpha. ये सबका transcription कम कर देता है. So this is how steroid acts, right? Okay. So there are 4 hormones that have got access into the cell, and remember it for your lifetime. STDR, steroid hormone, thyroid hormone, vitamin D and retinoids. जो भी फंक्शन है इनका, they can directly enter into the cell and they can change the velocity of protein manufacturing, factory, right? Okay. Now this part is over. Intracellular receptor. Now say someone is asking you in your Viva examination, beta batao to how vitamin D acts, what is the mechanism of action of vitamin D? So immediately you click the classification, okay, classification, yes, STDR, it is under STDR. Sir, vitamin D acts through intracytoplasmic receptor, it has got direct access into the cell, okay, full marks, okay. So even if you have not studied vitamin D separately, you know just the mechanism of action, so you can pass, okay, you can go through, you can face that Viva. Right? Someone is asking, please tell me mechanism of action of T3 and T4, thyroid hormone. Okay, you know. You have not studied thyroid hormone separately. Perhaps you have forgot or you didn't get enough time to cover thyroid hormone. But here you know the classification. Then you can very easily face that question. Yes, it is under STDR. So thyroid hormone's receptor must be inside the cell. Okay, at least you can tell this. Okay. The details of action is written under thyroid hormone. The details you don't know, but at least you know this. Okay, इसका receptor अंदर रहता है, cell के अंदर रहता है, right? This much you should know. Okay, okay. So now coming to cell surface receptor, the hormones जिसका receptor cell के surface में रहता है, ठीक है? Okay. And definitely they are not STDR. STDR छोड़ के बाकी सब hormone, ठीक है? जिसका सेल सरफेस में रिसेप्टर रहता है. इस STDR छोड़ के कोई भी हार्मोन पकड़ लो आप, ठीक है, देयर रिसेप्टर्स आर ऑन द सेल सरफेस. इंसुलिन होगा, ग्रोथ हार्मोन होगा, ठीक है, ACTH, पिट्यूटरी से जो भी हार्मोन निकल रहा है, ठीक है, सबका. कैटेकोलामाइंस लाइक एड्रेनालिन, नॉरएड्रेनालिन, एसिटाइलकोलिन, ठीक है, फिर एड्रेनल कॉर्टिकल हार्मोन नहीं होगा बिकॉज वो स्टेरॉइड में आ जाएगा, ठीक है. ग्लूकोकॉर्टिकॉइड, मिनरलोकॉर्टिकॉइड एंड सेक्स स्टेरॉइड, ठीक है, टेस्टोस्टेरॉन, एस्ट्रोजन, प्रोजेस्टेरॉन, एल्डोस्टेरॉन एंड कॉर्टिसोल, ठीक है. All these hormones are under this S. Okay, all these hormones are steroid hormone and under S. All will have intracytoplasmic or nuclear receptor. ठीक है. Okay. Now come to cell surface receptor. Now I will discuss cell surface receptor. Cell surface receptor. We classify cell surface receptor into few categories. One is ion channel receptor. ठीक है. Two is G protein coupled receptor. ठीक है. And third is enzyme linked receptor. ठीक है. सो क्लासिफिकेशन क्या हुआ रिसेप्टर का? रिसेप्टर का क्लासिफिकेशन हो गया इंट्रासेलुलर, and this is cell surface. Correct. Intracellular and cell surface receptor. Under cell surface again you have three categories. One is G protein coupled receptor, ion channel receptor, and third is enzyme linked receptor. Okay. So first discuss one by one. I will not discuss the detail of mechanism of action, just the classification. Classification and an example. Okay, that will be sufficient. Okay. So ion channel receptor. इसका मतलब क्या है? रिसेप्टर क्या होता है? जो सेल के सरफेस में रहता है या फिर सेल के अंदर भी रहता है, पहले हम लोग देखें. ठीक है. सो रिसेप्टर इज बेसिकली ए प्रोटीन. ठीक है. रिसेप्टर इज बेसिकली ए प्रोटीन. सेल के सरफेस में भी रह सकता है, इनसाइड द सेल भी रह सकता है. राइट. ओके. और आयन चैनल क्या होता है? ये भी एक प्रोटीन है जो सेल के सरफेस में रहता है, दैट कैन ट्रांसमिट आयंस. सोडियम एंट्री एग्जिट कर सकता है, पोटेशियम एंट्री एग्जिट कर सकता है. राइट. सो दीज आर आयन चैनल. ये भी एक प्रोटीन है. ठीक है. नाउ आयन चैनल रिसेप्टर क्या होता है? रिसेप्टर एक अलग चीज है जहां पर हार्मोन बाइंड करता है, और चैनल एक अलग चीज है जहां से सोडियम पोटेशियम क्लोराइड आना जाना करता है. राइट. नाउ आयन चैनल रिसेप्टर इज बेसिकली बोथ. इट इज एन आयन चैनल, इट इज ए रिसेप्टर. ठीक है. The same protein which is a receptor, it is also an ion channel. Right. This is called ion channel receptor. तो कौन कौन सा हार्मोन है जो आयन चैनल रिसेप्टर में बाइंड करता है? ठीक है. That you must remember, and remember the examples are glycine, GABA, glutamate, histamine. ठीक है. सेरोटोनिन. एटलीस्ट ये 5 याद रखो. GABA, glycine. What is GABA? GABA. Yes, gamma amino butyric acid. Okay, GABA. Okay. So glycine, GABA, glutamate, histamine, serotonin. ठीक है. These are all the hormones that binds to cell surface receptor. The same receptor is also an ion channel. Getting my point? Okay. Can you tell me what is the action of GABA? GABA क्या करता है? GABA एक हार्मोन है, न्यूरो हार्मोन. Yes? Yes, न्यूरो इनहिबिटर. ओके, न्यूरो इनहिबिटर, न्यूरॉन्स को इनहिबिट कर देता है. ठीक है. इसलिए GABA हम लोग कहाँ यूज करते हैं? एज मेडिकेशन. कौन से पेशेंट को GABA दिया जाता है, या फिर कोई ड्रग दैट इज मिमिकिंग GABA? जिसका न्यूरोनल एक्साइटेबिलिटी ज्यादा है. कौन सा पेशेंट का? एपिलेप्सी, सीजर डिसऑर्डर. ओके, सीजर डिसऑर्डर जहां पर न्यूरोनल एक्साइटेबिलिटी ज्यादा है, तो पेशेंट को काम करना पड़ेगा. काम, शांत रहो. ठीक है. तो इसके लिए हमें गाबार्जिक मेडिकेशन देना होता है. ठीक है. न्यूरोनल एक्साइटेबिलिटी को कम करने के लिए हमें क्या करना पड़ेगा? न्यूरोनल एक्साइटेबिलिटी क्यों बढ़ता है? एंट्री ऑफ पॉजिटिव आयन. न्यूरॉन के अंदर अगर पॉजिटिव आयन एंट्री होता है तो न्यूरोनल एक्साइटेबिलिटी ज्यादा होता है, तभी ना एक्शन पोटेंशियल फायर होगा. राइट. ओके. और न्यूरॉन का सेल बॉडी से आप अगर पॉजिटिव आयन को बाहर निकालोगे या फिर नेगेटिव आयन जैसे कि क्लोराइड आयन, ओके, इफ क्लोराइड आयन एंटर्स इनटू द सेल एक्साइटेबिलिटी विल फॉल, ओके, शांत हो जाएगा, ठीक है। तो गाबा का काम ही है ये कि सेल के अंदर क्लोराइड आयन भेजो, राइट, सो दैट न्यूरोनल एक्साइटेबिलिटी इज लॉस्ट, ठीक है, ओके। नाउ द थिंग इज GABA receptor chloride channel complex. It is a pentameric protein which has got 5 subunits. It is a pentameric protein and it looks like this. Right. So it has got 5 subunits, okay, and this is GABA, and here is the receptor for GABA, okay. This is GABA, this is the cell membrane, and this is inside the cell, okay. Now once GABA binds here, the channel opens, okay, the channel opens. If you do a cross section over here, right, if I do a cross section over here, this 5 subunits, it looks like somewhat, I will not be able to draw, it looks like somewhat this thing, right. The five subunits are arranged in this way in a whorl, right, okay, and once GABA binds to this, it unwinds, right, it unwinds and the pore between opens up, right, and through this pore chloride enters into the cell, clear. So this is how GABA or any GABAergic medication that we use in epilepsy or any case of neuronal excitability, right, seizure disorder, right. So GABA binds on the alpha subunit, there are subunits alpha, beta, gamma, right. GABA binds on the alpha subunit and after binding of GABA there is a structural change of this protein, okay, and it rotates like this, anti-clockwise and the pore forms inside. Otherwise normally this pore is closed due to the arrangement of 5 subunits, okay. Once GABA binds here, it unwinds and the pore inside opens up and chloride enters into the cell, into the neuron, okay. And chloride is negative ion, it will reduce the excitability of the neuron and epilepsy will stop or the seizure will stop, okay. This is how it acts, okay. So you see, it is the same protein which is acting as a receptor, GABA receptor, and the same protein, it is also an ion channel for chloride ion, right. So this is why we are calling it ion channel receptor. And what are the hormones that acts through ion channel receptor? One example is definitely GABA because I have given this example, right. What are the others? GABA, glycine, histamine, glutamate. So similarly, opposite to GABA is glutamate. It enhances neuronal excitability. Okay, glutamate enhances excitability because it transmits sodium inside, it transmits potassium inside, and the neuronal excitability will increase. Okay, right? Okay. So, but the receptor looks different for glutamate. It is called NMDA and AMPA receptor. Anyway, we will come to it. Okay. So remember one example GABA details and remember all the hormones that acts through ion channel receptor. Okay. So GABA, glycine, histamine, serotonin, glutamate. 5 example you can remember. That's enough, right? Okay. Now come to G protein coupled receptor. ये आप लोग details में पढ़े हो already. Okay. This cyclic AMP pathway, cyclic GMP pathway. You have got details because the receptor यहाँ पर क्या है? Previously ion channel receptor, that means the receptor is also ion channel. Now it is G protein coupled receptor, मतलब the receptor is associated with another protein. Receptor अकेला नहीं रहता है, इसको एक चाहिए GFBF जो भी है, ठीक है? तो रिसेप्टर के साथ एक और प्रोटीन है, वी कॉल इट जी प्रोटीन, ठीक है। रिसेप्टर के साथ एक जी प्रोटीन है, गर्लफ्रेंड है, साथ में रहता है, ठीक है। तो रिसेप्टर के साथ जी प्रोटीन है। जी प्रोटीन, हाउ डज इट लुक लाइक? इट इज अ सर्पेंटाइन रिसेप्टर, 7 times it crosses the membrane, cell membrane, okay. If this is the cell membrane, this is the cell membrane, it crosses the membrane 7 times, okay, 1 2 3 4 5 6 and 7, ठीक है। This is G protein coupled receptor, this is the receptor, and ये अकेला नहीं रहता है, इसको एक गर्लफ्रेंड चाहिए, ठीक है। तो ये G प्रोटीन के साथ रहता है, ठीक है। इट इज एसोसिएटेड विद G प्रोटीन, ओके। नाउ G प्रोटीन का 3 सब यूनिट होता है, ऑल ऑफ यू नो, अल्फा बीटा गामा, ओके। नाउ दिस इज द स्ट्रक्चर ऑफ G प्रोटीन कपल्ड रिसेप्टर। G प्रोटीन कपल्ड रिसेप्टर में कौन कौन से हार्मोन है जो G प्रोटीन कपल्ड रिसेप्टर में एक्ट करता है? ऑलमोस्ट ऑल द हार्मोन्स, द एड्रेनालिन, नॉरएड्रेनालिन, ओके, all the hormones that are coming from pituitary, anterior pituitary and posterior pituitary, oxytocin, ADH, right? Then your except growth hormone, not growth hormone, okay, prolactin, ACTH, TSH, okay, all the hormones except growth hormone, all the hormones except growth hormone acts through G protein coupled receptor, okay. Now take any example, say for example epinephrine or ACTH, a hormone. So that hormone will bind here, G protein में bind करेगा. Now once the hormone binds to G protein, there will be dissociation of G protein, okay. Once the hormone binds to GPCR or G protein coupled receptor, there will be dissociation of all the subunits in G protein. G protein में क्या क्या subunits है? अल्फा, बीटा, गामा. अल्फा सेपरेट हो जाएगा, दिस इज अल्फा, एंड बीटा गामा एक साथ रहेगा, ठीक है। नाउ अल्फा विल एक्टिवेट सम डाउनस्ट्रीम एंजाइम, लाइक क्या एंजाइम का नाम है? एडिनाइलिल साइक्लेज, ओके। एडिनाइलिल साइक्लेज क्या करेगा? ये साइक्लिक एएमपी, ओके, साइक्लिक एएमपी में कन्वर्ट होगा, ठीक है। ये तो पढ़ेगा आप लोग, ठीक है। A very common question. This question is very common for your theory purpose, right? So G protein coupled receptor, and there will be formation of protein kinase that will phosphorylate some further protein, and that will initiate their action. Just ACTH. ACTH का function क्या है? What is the function of ACTH? It will stimulate adrenal cortex to release sex corticoid, mineralocorticoid, glucocorticoid. ठीक है। So to do this ACTH has to bind here, okay. It should act through G protein coupled receptor, okay, in this way, okay. So remember, I am not here to discuss in detail the mechanism of action. I am here just to represent you the classification, okay. The detailed mechanism of action you need to study, okay. और whenever we will take classes on separate hormone like ACTH के ऊपर हम लोग क्लास रहे तो डिटेल मैकेनिज्म ऑफ एक्शन we will discuss, okay. Okay, so ion channel receptor example सबको पता है. Now G protein coupled receptor, name all the hormones from the pituitary except growth hormone, right? All are example of G protein coupled receptor, okay. ACTH, FSH, LH, TSH, okay, everything whatever is coming from pituitary except growth hormone are the example of G protein coupled receptor, and also epinephrine and norepinephrine that are coming from adrenal medulla. Clear? Now another difficult part is enzyme linked receptor. Enzyme linked receptor, the third one under cell surface receptor is called enzyme linked receptor. Here you need to remember few things, okay. मुखस्त करते हैं. Now as I told, ion channel receptor, the same protein which is a receptor, the same protein is behaving like an ion channel. Here is also same concept. Enzyme is a protein, receptor is also protein. But here the same protein, it is an enzyme, it is also a receptor. Okay, I have already given an example. Tell me. Insulin, yes, insulin. इंसुलिन का जो रिसेप्टर है, the same receptor is also enzyme. Which enzyme? Tyrosine kinase. Okay? Okay. तो यहाँ पर under enzyme linked receptor, all the receptors are, receptor तो definitely है primarily, but they are also enzymes. Okay? So classify enzyme linked receptor under 4 categories. Okay? Number 1, receptor guanylyl cyclase. Right? Receptor tyrosine kinase. Receptor tyrosine kinase associated and receptor serine threonine kinase, right? So under enzyme linked receptor you have 5 subheadings. এই জায়গাটা একটু মুখস্থ করতে হবে, এখন পরে মনে থাকবে, ঠিক আছে? Receptor serine threonine kinase, receptor tyrosine kinase associated, receptor tyrosine kinase, এগুলো শর্ট ফর্ম আছে। রিসেপ্টর টাইরোসিন কাইনেজ, এটাকে আমরা বলি আরটিকে। রিসেপ্টর টাইরোসিন কাইনেজ অ্যাসোসিয়েটেড, এটাকে আমরা বলি আরটিকেএ। ওকে, আর এটাকে বলি সিরিন থ্রিওনিন কাইনেজ এসটিকে। ওকে, okay, now receptor guanylyl cyclase. Number 1, receptor guanylyl cyclase. Receptor guanylyl cyclase. इसका एग्जाम्पल नाइट्रिक ऑक्साइड, atrial natriuretic peptide. Nitric oxide and atrial natriuretic peptide. Have you heard the name of the hormone ANP, atrial natriuretic peptide? It is a hormone which is secreted from atria, heart, right? And its function is to release sodium in urine. Atrial natriuretic peptide. আমি পড়েছিলাম যখন ব্যারো রিসেপ্টর পড়েছিলাম। ওকে, so nitric oxide, it is also a hormone. What is the function of nitric oxide? Vasodilation. Very good. Okay, so nitric oxide का function होता है vasodilation, and atrial natriuretic peptide, it is a hormone which is being secreted from atria and its function is to release sodium in urine. ठीक है, natriuresis, natrium means sodium, so natriuretic peptide, it is a peptide hormone that releases sodium in urine. Okay, by doing this it reduces blood pressure. Nitric oxide also reduces blood pressure by doing vasodilation, right? Okay, so receptor guanylyl cyclase example is NO and NP, right? Okay, now number 2 is RTK, receptor tyrosine kinase, example is बोल चुका हूं already, insulin. Yes. Okay, so what is the mechanism of action of insulin? Your answer should be, sir, insulin belongs to the classification of receptor called enzyme linked receptor, and under enzyme linked receptor insulin is classified under RTK, receptor tyrosine kinase, because insulin का जो receptor होता है वो एक enzyme भी है। क्या enzyme? Tyrosine kinase। ठीक है? Okay, so insulin and all growth factors excepting growth hormone, ठीक है, and growth factors, all growth factors are RTK, all growth factors. Okay, all growth factors are receptor tyrosine kinase. Okay, क्या क्या growth factors होता है? जैसे nerve growth factor, fibroblast growth factor, okay, endothelial derived growth factor, platelet derived growth factor, ठीक है, insulin like growth factor 1, IGF-1, all these belongs to RTK. Now RTKA, RTKA is receptor tyrosine kinase associated. Here example is growth hormone, erythropoietin, interleukin, thrombopoietin, right? Tumor necrosis factor. Okay, all these will come under RTKA, receptor tyrosine kinase associated. Okay, here in RTKA there will be JAK-STAT pathway. Have you heard the JAK-STAT pathway name? Okay, very frequently it comes as short note. Okay, so growth hormone acts through JAK-STAT pathway, which is a part of receptor tyrosine kinase associated receptor, right? And now finally, I am just explaining the classification. Receptor serine threonine kinase. Example is TGF, transdermal growth factor beta. So remember, only TGF will be excluded here in RTK. All the growth factors are under RTK, but transdermal growth factor is under receptor serine threonine kinase. Okay, transdermal growth factor beta, bone morphogenic protein BMP, and AMH or anti-Mullerian hormone. Do you know what is anti-Mullerian hormone? It causes agenesis of Mullerian duct. Okay, Mullerian duct, right? So that the fetus is a male. Okay, correct? So the anti-Mullerian hormone acts through receptor serine threonine kinase. Okay, so if you remember this classification and the example, you can tell mechanism of action of any hormone. Whatever hormone is asked in your examination, you can at least tell which classification it belongs to, right? And this is what is required. Okay, so this is how the total classification of receptor and also the classification of hormone actions. Okay, so remember it. এটা বারবার পড়ে এক জায়গায় লিখে এটা পুরো মুখস্থ করে নিতে হবে, ঠিক আছে? Then there will be no problem in dealing with endocrinology or anything in future, pharmacology, pathology, medicine. Okay, everything will be easier for you. You must remember this for your lifetime. Okay, chalo, thank you.